We are here with the co-founder of EMC Squared. How are you, Erin?
I'm doing great, Unity.
So it's an honor to be here with you in person. I thought we'd start the conversation just learning about your vision for EMC Squared.
What we're looking to do is give access to every individual in the world the access to clinically proven self-healing techniques. So that's what E equals MC squared no limits is about. We build and offer basically 6 and 12-week programs that involve empowerment, nutrition, and physical fitness. And we train and develop integrative therapists to deliver the program. And our aim is to bring these programs to places where they don't already exist. And we are also looking to secure reimbursement for these programs.
And there's so many people that need this. I think of the military, and I know this is an area that you're doing a lot of work now. I don't know if you want to talk a little bit about that and how you're thinking about that.
Yes, absolutely. So my father is a retired colonel in the U.S. Army. And in the last 4 years, he's been diagnosed with type 2 diabetes, a brain tumor, as well as potentially early onset Parkinson's disease. All of these diagnoses have been directly connected to Agent Orange. And so he knows about the work we're doing. He believes it has a place in the military. And so he has been actively supporting us in bringing it to this space. And although the military is doing amazing work, really beginning to offer a lot of really amazing self-healing techniques like Tai Chi, Qigong, cognitive behavioral therapy, it's not quite at a point where it's being adopted at the level that we would like to see. So programs like the Trifecta Core Health Initiative aim to address that.
There's a holistic approach here, and I think a lot of medicine today doesn't often take a holistic approach. What are your thoughts on that, and how did you sort of come to create this trifecta? What was the genesis, I guess, of the idea?
I spent the last 15 years working in the pharmaceutical and medical device industry. So I worked for Pfizer, Boston Scientific, Medtronic. I learned a tremendous amount about what is working and what is not in the system. I'm grateful to say that I've seen lives saved with the medical technology that exists out there. It's just amazing to see how surgeries and how pharmacotherapy have developed over the years. The purpose of the Trifecta Core Health Initiative is to address something that's not currently being addressed, and that is the root cause of what's happening with the individual. And look, we can have the best nutritional and physical fitness programs in the world, but if an individual does not feel like they're here to thrive and they feel like they're here to just survive, then none of it's sustainable. So what we're looking to do is, number one, give people choices, give them options for their overall well-being. Let them know that they do have an opportunity to optimize their well-being. So that's essentially what the program is about.
So you've been in the healthcare industry for many years. Now you're an entrepreneur in health. What's that transition been like? What have you learned as being an entrepreneur?
Oh, it's been easy peasy. Yeah, it's been amazing. It's been fascinating. And our co-founder, Maria Conchetta Chalufo, all I can say is thank God for her. She has been tremendous during this process. Her background is in private equity, and she is also an entrepreneur. So between the two of us, we've been able to cover the bases. I would say for me, one of the biggest challenges early on, and it seems trivial, but it wasn't something I thought about initially, is not having access to the resources that I did when I was working, for the world's largest medical device company. Not having the budget, not having the clinical support. So it's really been about making those choices and recognizing what is our capacity to do what we need to do. And I have to say, during the last 18 months, we've become pretty efficient as a result of that.
So biggest lessons learned over the last 18 months?
I can't say there's anything that I would do again, just because it's brought us to where we are today. I do think when we began canvassing clients and just identifying cohorts that would be appropriate to begin this program in, we cast a pretty wide net. And I'm okay with that. I think it kind of maybe de-accelerated things a little bit early on. So I would say at this point,
Because there was a broad focus initially as
Exactly.
opposed to laser.
Exactly. We cast a really wide net. We were traveling a lot, and so it wasn't as efficient as it could have been. And the good thing about that is, we recognize that. We recognize that within, I would say, the first 6 to 8 months of beginning to operationalize the concept. And so we were able to Marie and I were able to take a closer look at, okay, what choices do we need to make here? We had a couple of opportunities in Brazil. We had an opportunity with a large academic teaching institution in the United States. Both at the time were requiring a lot of resources that we weren't prepared to deliver on. So some tough choices for sure,
Right.
but we're getting there.
Yeah, getting that focus as early as you can save a lot of time and resources for sure. What are you most excited about for the future?
What gets me up every day and keeps me motivated to do the work I do is, first and foremost, I get to do what I love now. And it's not to say that I didn't love what I was doing before. I'm so grateful. I was supported tremendously by the companies that I worked for, and I just learned so much by being there. This opportunity to bring clinically proven self-healing techniques to places in the world where they don't already exist is something that I'm willing to do whatever it takes to execute on.
Fantastic. Well, thank you so much for everything that you're doing. Where can people go to learn more about E equals MC squared?
Thank you, Unity, and thank you, Startup Health, for all of your support. So folks can go to www.emcsquared.com.
Awesome. Well, thank you so much.
Thank you.